This is an updated version on the lecture of field of vision. Now we come to the accuracy. In the Humphrey, here we have fixation losses, false positive, false negative, and gaze tracker. Fixation losses that through the test, every now and then a stimulus is directed in the blind spot and the patient should not see it. But if the patient does not fix correctly, then the stimulus will fall in a seeing area and the patient will answer that he sees it. Fixation losses in case of enlargement of the blind spot, still the patient can move his eye and will give an answer that he does not see it. What's about false positive? False positive is the patient is responding to the click he hears during the test, or if the patient responds before or during the stimulus presentation, or if the patient responds too soon after the stimulus presentation. False positive maximum should be 15%. Other than that, then most probably the test is not reliable. What about false negative? False negative, that after testing a point and reaching to the level that we say this point has a sensitivity of so and so, after a while the software will stimulate this point again with the strongest stimulus, and we are expecting that the patient to answer yes, he sees it, but he will say he doesn't see it. This is false negative. High false negative error tends to make visual field seems worse. The threshold decline the longer the test goes, and also fatigue accounts for that. Again, an elevated, in cases of glaucoma, the sensitivity of the retina by time decreases and the rate of false negative will be higher. So we can accept false negative rates of a rate of 30. Again, next is the gaze tracker. It is found in the bottom of the printout. We have reflection of line. This is the test over the time. We have reflections up and reflections down. Reflections up mean that there was a gaze error. Reflection down means that the software could not detect the gaze. It was not recorded. The gaze tracker depends on the software, or the machine get the image of the reflection on the center of the cornea and also the image of the pupil. If the patient moved his eye, then the distance between these two will be larger than normal. This is an example. Over the time, fixation was fine, then it was bad in this area, and again fine again. So this is acceptable. Here the gaze tracker show so many times there was an artifact, there was improper gaze, so it is not acceptable. In case of octopus, we, instead of false positive, false negative, we have false catch trial and negative catch trial, and at the bottom here we have the reliability factor. So positive catch trial similar, and negative catch trial similar to those of the Humphrey. Positive catch trial can be in the range of 10 to 33%. Negative catch trial can be between 20 to 30%. What is the reliability factor? Reliability factor is the sum of the false positive answers and the false negative answers divided by the total number of catch trials. For example, patient get 1 false positive out of 20, 3 false negative out of 21. So if we add them together, it will be 4 divided by 41, which equal to 9.8%. We should accept whenever the value is 15%, but if it's higher than 15%, we don't accept it. And a result 0 is the perfect one. We don't have fixation losses in the octopus simply because if there is no fixation correctly and the patient moves his eye, the test stops, alarm signals, and the operator will come and ask the patient to fix properly. This is the reliability factor. It should be less than 15%. Here it is 0%.